fills up like a triangle upon just lightly touching it, and that's a mark that there's a significant amount of inflammation, that the gum tissue, the connective tissue is weak, and really is something that needs some significant work to.
Placed upon them. When hard tooth material is worn away as a result of teeth grinding and/or clenching, it is called attrition. The extent of wear damage depends on the amount of grinding and is typically more severe in individuals who exhibit this behavior in their sleep. Outer enamel of the teeth and can expose the softer underlying dentin layer. Abrasion can be caused by improper toothbrushing technique, excessive use of toothpicks, and any oral health complications, including unattractive and irregular tooth levels. Treat the issue before more damage is sustained.
Replacing the missing teeth will restore your ability to properly chew and speak besides its cosmetic advantages. In addition, the space caused by the missing teeth may allow the surrounding teeth to shift into that space. This shifting could cause a misalignment in your bite that can result in problems with your jaw joint. These shifted teeth are harder to clean, making them more susceptible to gum disease, decay, or even additional tooth loss. It normally take a look at different options. Even though rare, a full metal bridge is more suitable for replacing a missing tooth in the back of your mouth. Metal bridges are often the best option for people who have worn their teeth excessively. Note, there are different metals to choose from, but as a rule, the more precious metal or gold content in the metal, the better the fit of the bridge, and the better the health of the gums around it. It has a porcelain exterior with a metal framework supporting it underneath. The porcelain gives you the desired aesthetic, and the metal framework provides better structural support, making the porcelain much stronger. This type of porcelain metal hybrid bridge can be used to replace missing teeth in any area of the mouth, front or back. Again, as a rule, the more precious metal or gold content in the metal, the better the fit of the bridge, and the better the health of the gums around it.
Clear aligners are a unique procedure allowing the movement of teeth using a series of transparent custom-made trays. Clear aligners could be compared with invisible braces. The trays are small guides made with a transparent material, thus making them practically invisible. They are designed by high-technology 3D computer science. The trays will be made exclusively for your mouth. Because they are smooth, clear aligners do not further upkeep. Each tray must be worn for a period of 2 weeks, allowing a gradual movement of the teeth to be displaced. The length of the treatment can vary from one person to the next, depending on the condition.
This outlines how to treat a cavity on the proximal surface of the tooth, or the area of a tooth in between teeth. Conservative cavity preparation is done. When preparing a tooth to treat a proximal cavity, a matrix band will be placed to confine the filling. The tooth enamel will be treated with an acidic conditioner called the etchant. The etchant dissolves some of the mineral content of the enamel, creating surface roughness at the microscopic level. A frosted glass appearance of the treated surface appears after the etchant is introduced. At this time, the bonding agent applied. Bonding agent then flows into the surface roughness, creating resin tags when hardened with a special curing light. The bonding agent now attaches itself to the etched enamel surface. Dental composite is then added to incrementally build the bulk of the restoration. Each increment chemically bonds to the previous and hardens to form a strong surface.
Esto dificulta y hace incómodo que buscan el contacto con el diente perdido, inclinándose y cerrando el espacio. Del mismo modo, el diente contrario erupciona buscando el contacto correspondiente. Esta movilización generalizada puede desencadenar, incluso se abren, facilitando así la retención de alimentos entre los dientes y por ello la aparición de caries. Sarro con facilidad, favoreciendo la aparición de periodontitis. Esto disminuye la porción de raíz que permanece dentro del hueso, pudiendo incluso presentar movilidad, forzando cargas sobre ellos y causando desgaste, sino también restaurar la relación de mordida a su punto original, obligándonos podemos necesitar realizar
There is a requirement for a similar incision, but which under surgical magnification involves a much shorter line than what is illustrated here. But this time, we have to remove some of the overlying bone around the tooth, and this involves a surgical drill and surgical standards of operative care. And we can use the same drill to divide the tooth into smaller portions, which we can then elevate separately and safely. This kind of surgery limits the amount of surgical trauma, reduces risk form that can cause gum infection, and also potential loss of the tooth in front of the wisdom tooth. The gum flap is the same as for other forms of impaction. Again, it can be much shorter using surgical magnification. The amount of bone we remove is designed to be as small as possible, and using micro-instrumentation, it is through this small hole we can carefully divide the tooth into multiple pieces, being careful to preserve adjacent teeth and nearby nerves. We can also fill in the bone defect with bone graft material to ensure a complete bony healing.
Wear caused by an outside object is called abrasion. Abrasion can be caused by improper toothbrushing technique, excessive use of toothpicks,
Use a small-headed fluoride toothpaste. Start by tilting the toothbrush against your teeth so the bristles are at a 45-degree angle to the gum line. Move the brush in small circular movements of each tooth, keeping the bristles angled again. Do the same thing for the inside surfaces of all the teeth. Now, brush the biting surfaces of the teeth. On the top, clean the inside surface of the front teeth. Tilt the brush vertically for the upper teeth. Gently move the brush and pull the toothbrush gently upwards from the gum for a few seconds.
Opening is made in your gums, and a channel for each implant is shaped in the bone. Next, we place the implants into the prepared channels. Sometimes covers are placed on the implants, and the gums are stitched closed for healing. In other cases, a healing cap or an extension is attached to each implant, and then a temporary bridge may be placed over the implants or attached to the adjacent teeth. Healing may take several months as the implants become securely fused to the bone. An implant-supported bridge has several advantages. The implants stop the bone loss that occurs when teeth are lost, and the bridge prevents the surrounding teeth from shifting into the space. And unlike a traditional bridge, there's no need to reduce neighboring teeth.
This movie shows how the TMJ disc is flattened and traumatized with the loss of posterior occlusion. With the loss of opposing molar teeth, there is no contact in the back of the mouth, and therefore the jaw overcloses. This can cause pain and clicking in the region. In addition, the front teeth now bear all the pressures of occlusion, and the continued trauma causes them to splay outwards and become more and more mobile. In severe
and bone. Impacted teeth can take many positions in the bone as they attempt to find a pathway that will allow them to erupt successfully. These poorly positioned impacted teeth can cause many problems. When they are partially erupted, the opening around the tooth allow bacteria to grow and will eventually cause an infection. The result: swelling, stiffness, pain, and illness. The pressure from the erupting wisdom tooth may move other teeth and disrupt the orthodontic or natural alignment of teeth. Removal of the offending impacted tooth or teeth usually resolves these problems. Early removal is recommended to avoid future problems and decrease the surgical risk involved with the procedure. The first step of third molar surgery or wisdom tooth extraction is uncovering it and sectioning the tooth for easy removal. The surgical site will then be sealed.
Through the crown of the tooth and into the pulp chamber. Fluid is put in the canals to kill any bacteria and help rinse out debris. Then, the pulp is removed. Using small instruments, the endodontist carefully cleans and shapes the canals. After the space is cleaned and shaped, the endodontist fills and seals the root canals. In most cases, a temporary filling is placed to close the opening until you see your dentist. After your endodontist is finished, properly restored with a filling or crown.
Even with regular dental visits, over time our teeth can break, be lost due to dental disease, and the remaining ones can shift. Our teeth can become worn down, our chewing function can be affected, and generally our overall oral health can degenerate. If you have some or all of these dental conditions, then you may be a candidate for a full mouth rehabilitation. Your teeth may be restored using a combination of veneers, crowns, or dental implants. Dental implants are restorations that are used to replace missing teeth. Crowns are restorations that cover your teeth and are used to reinforce broken down teeth and can also improve their aesthetic appearance. Veneers are shells of porcelain that are bonded onto your teeth to improve their shape and appearance. Your individual needs will be determined by your dentist. A full mouth rehabilitation helps to restore your oral health and improve the longevity of your teeth and their appearance.